Hello, welcome to the Christian Academy, the YouTube channel which brings you about mathematics and sciences in general. Now we are going to discuss about biology in context of health, and I would like to request each and everybody who is watching this video first make subscribe, comment, share and like, such that any video I would like to upload on my channel, you are ready to watch it. Thank you very much. Now I brought here a lesson or a point which is very important for men and women, because we know that we are the one. I have a point which is called 10 reasons for a missed or late period to the female. Here I have 10 reasons why a female can miss his period or late period, menstruation period. Welcome. So now I would like to invite each and everybody who is watching this video to turn his mind about pregnancy. Even if you are not a woman, but you have a woman, or you have a sisters and brothers. That's why everybody is encouraged to understand this lesson. Pregnancy is by far the most common cause of a missed period, but there are some other medical and lifestyle factors that can affect your menstrual cycle. So the extreme, here we have an extent like an extreme weight loss, hormonal irregularities, and menopause are among the most common causes if you are not pregnant. Three main causes of losing period or menstruation period: it is hormonal irregularities, the weight loss, extremely, and the menopause. So you may miss a period for 1 or 2 months, or you may experience completely amenorrhea. So that is no period for 3 or more months in a row. This article explores 10 common reasons your period may be delayed. Welcome to these points. The first point, it is stress. Stress. I think everybody understands the stress. So the intensive stress interrupts the production of gonadotropin releasing hormone, and a hormone that regulates ovulation and the menstrual cycle. This is the hormone which is responsible for regulation of ovulation and the menstrual cycle. So the intensive stress interrupts what? That production of gonadotropin releasing hormone. So missing one period while going through a very stress situation is not uncommon. However, if you are under prolonged stress and miss more than one period, consider scheduling a visit with your healthcare providers. So to miss your month, like 1 month or 2 months, you have to see overleaf those health care providers. Once your stress is back to a manageable level, it may take a few months or more for your cycle to become regular again. This is the first point you have that can cause to lose or to late period on the woman. So stress, please reduce stress. The second point is extreme exercises. As a woman, if you do or you like it to work more exercises, it causes also to lose that menstruation period. So the extreme exercises can cause changes in pituitary hormones and thyroid hormones, which can impact ovulation and menstruation. Working out for 1 or more 2 hours per day should not affect your menstruation cycle. So it takes hours upon hours of demanding exercises every day for those hormonal changes to occur. By the way, if you are planning on exercising that much, you may want to consult with a sports medicine healthcare providers. They know how to arrange them and give you an appropriate time to to use such that you can exercise extremely. So optimizing your diet with nutritious food that boost your energy. The medicine healthcare providers are able to give you the ideas and help you to optimize your diet with nutritious food that boost your energy, and also are responsible for teaching you stretching techniques to reduce physical stress. So the second point that, as I said, is extremely exercise. Please regulate your exercise. The number 3 is illness. The chronic condition that can affect your menstrual cycle includes, we know that the effects of menstrual cycle can also be based on the illness. One of the illness likely to be to let menstrual cycle to be chronic includes thyroid disease. There is also what we call polycystic ovary syndrome. There is pituitary tumor. There is disease of the adrenal glands, the ovarian cysts, liver dysfunction, and diabetes. These are diseases that can affect your menstrual cycle. So many illnesses and disorders can interfere with your cycle until they are treated. Once the underlying condition is resolved, it might take a few months before period returns again. So in this point of illness, I think not much to say about it, because we feel that there are different diseases that can cause that menstrual cycle not take place. The point number 4, it is change in your schedules. Change in your schedule. Changing can throw off your body clock. If you frequently change work shifts from days to night, or if your schedule is generally all over the place, your period can be fairly unpredictable. A change in your schedule should not cause you to completely miss your period, but it can cause your period to start earlier or later than expected. Your cycle can also change by a few days if you experience jet lag. So if we say that at this point, I think as I said, you understand it. The change in your schedules, this simply means if you like to have a job but you work a day and then you change to work a night, this also can affect your menstrual cycle, but not completely. The point number 5 we have here, it is medications such as antidepressants. There are some medications like antidepressants, antipsychotics, thyroid medications, convulsants, and some chemotherapy medications may cause your period to be absent or delayed. So here, hormonally contraceptives like Depo-Provia, or what you call Depo-Provera, progesterone, yes, only mean pills. So here, IUD, I think you know IUD, and Nexplanon can also influence your cycle. So different types of contraceptive can affect your menstrual cycle in different ways. Some contraceptives are associated with heavy periods. This was the point which is called medication. Can be one of the key to layer the period on the woman. So we have another point, number 6, which is called the weight changes. Weight changes here are, weight. It's the body mass. Here, being overweight, underweight, or experiencing drastic changes in weights or impact your cycle. So here, obesity influence estrogen and progesterone regulation and may even lead to issues with fertility. So a very high body mass index, or BMI, is associated with missed periods, and weight loss can help regulate the menstrual cycle for women when are obese. Yeah, and rapid weight changes due to the illness or medication, even the dietary changes may interferes with hormones production or release in return. This may cause what we call missing the menstrual period. So this was the point called weight changes. Let us go to the next point, which is all about recently started period, and the normal menstrual cycle lasts from 21 to 35 days in healthy women, but it can vary. This is especially true for young women who are just starting to get their periods, or for women who have not had periods for several years and are starting again. So the young woman has only had a few cycles, may go a month without another one until a regular pattern begins, and women who have not had a period due to the contraceptive use or hormonal therapy, even illness, may not resume regularly. This is all about the regular or recently started periods. The reason number 8 is perimenopause and menopause. Here I am explaining perimenopause is the period of transition between reproductive age to non-reproductive age. So your period may be lighter, heavier, more frequent or less frequent during this time. So in most cases, they will just be different than what you are used to. So if we say the menopause is when you have reached the point in which life where you will no longer ovulate or menstruate. So the average age of the menopause is 51 years old. You can miss your menstruation period due to perimenopause and the menopause. As I explained this, the reason number 9, it is breastfeeding. So you may have right period, so infrequent period or amenorrhea when breastfeeding, particularly if breastfeeding provides your baby with or almost all of their calories. And many women believe that breastfeeding is a form of birth control, but it's not. Even if you don't have periods when you are breastfeeding, you get pregnant. If you are not ready for another child, you should still use contraceptive ways. So this is another key which can cause to late period in a woman. So the number 10 or reason number 10 is ectopic pregnancy. So if you think you can't be pregnant because you have an IUD, there is a small chance that you may misuse the period. Could be a sign of an ectopregnancy. So ectopregnancy can sometimes happen due to the shape of the IUD, and you may not test positive on pregnant test. Either your healthcare provider can check for it with a pelvic examination or an ultrasound. So symptoms of ectopregnancy includes like cramping in your lower abdomen, there is shoulder pain, there is weakness or dizziness, there is nausea, and breast tenderness. Some women have missed period while others have vaginal bleeding or spotting. In addition to the use of an IUD, other factors that are associated with ectopic pregnancy includes endometriosis, there is pelvic inflammatory disease, there is progestin-only birth control pills, There is a history of sexually transmitted infections. There is a history of infertility and birth defects of the fallopian tube. So ectopic pregnancy is a life-threatening condition. Seek medical attention right away if you miss your period and think you might be at risk. So when to call your healthy provider? When? Above these points, almost 10 points. Here there is a reason why you can call health provider. By the time when missing a period, every once in a while is usually not cause of cancer, concerned pregnancy. So that says you should see a healthy care provider if you miss more than one period or your missed period is accompanied by new unusual symptoms. So seek the medical attention right away if you also experience any of the following signs: new or worsening headache, vision changes, nausea or vomiting, fevers, hair loss, breast discharge or milk production, and excess hair growth. So even I would like to invite our women and to be able to know or to understand how to use the app called Period Track app. This Period Track app help you to arrange your period such that you can do anything bad to you because you don't know your exact period. So thank you. This is almost these 10 points. Let me repeat once how I'll train them. If you see any these, or if you exercise any following these reasons, you have to know that it can lead to miss or late period to you as a woman. So the first point, we find that it is stress. The second point is extreme exercises. The third point, it is illness. Number 4, it is change in your schedule. Number 5, it is medication. Number 6, it is weight changes. Number 7, it is recently started period. Number 8, it is perimenopause and menopause. Number 9, it is breastfeeding. Number 10, it is ectopic pregnancy. And this is almost the 10 reasons why can make the woman to lose or late period in usual life. I would like to invite you also to make subscribe, comment, share, and like, and such that the next following videos you have not missed them. This channel is very important and we would like to show you different biological knowledge and biological skills, even health skills concerning biology. At the next video, we would like to explain more about diabetes and your period, like 5 things women needs to know. The number 2 point, the next point is also it is missed period and gas stomach. Are you pregnant? Yes, this is the next point. Why is my period late while I'm in birth control? Yeah. Why is my period late while I'm not in birth control? Why do I get my period twice a month? How soon can you take a pregnancy test? Blood discharge causes and how to treat it. How the hypothalamus controls your menstrual cycle. The potential meaning of a lighter period or you are healthy. So these are the next points we would like to talk about it. Thank you for watching this point of today. See you to the next day. Subscribe please. Thank you.